Okay, public health and the health system. We're going to review for test number 2, chapters 3 and 4. And I'm going to try to cover specifically the test questions, or at least the information in the test questions. So I'm going to be going through this pretty quickly. As far as levels of prevention, that's an extremely important topic. Primary prevention, eating lots of fruits and vegetables, don't smoke, making sure you're getting a lot of exercise, the healthy lifestyle choices, get vaccinated, things like that are going to prevent illness. Secondary prevention, that's when you pick up the presence of a disease. So that's where screening techniques come in, breast cancer screening, colorectal cancer screening. So you detect the early detection, hopefully the early detection of a disease. And then tertiary, which is basically minimizing further damage from a disease that you already have, or trying to delay the death from a disease that you already have, or minimizing comorbidities associated with a disease that you already have. So that's more like kind of late stage level prevention. Unfortunately, most of the prevention that's done in our culture is tertiary prevention, that third step. It's kind of a shame, but that's hopefully we're starting to turn that around a little bit. I'm going to give a whole nother presentation on this. If you look at this upper left-hand corner, interaction of agent, host, and environmental factors, that's kind of an important concept. It's called the epidemiological triad, and I'm going to do a whole nother presentation on that at some point. Other than that, I think we can kind of, I don't want to say that this is not important, read through it, but there's nothing specifically on the test about this as far as I can remember. And again, this is just a more kind of additional information about this. Again, primary prevention is, aimed at people that are vulnerable but are not yet sick. People that are afflicted without complications, secondary prevention. So they're the ones that we're trying to catch in the early stages of disease. And then, of course, tertiary prevention is trying to prevent somebody from dying from complications that's already affected. The health impact pyramid, very, very important here. Socioeconomic factors are by far the biggest factor that impact our overall health. So with increasing population impact, you can see the further down you go is the more population impact that it has. So rather than we focus a lot on clinical interventions, but socioeconomics is really the key here. So we know that certain minority groups either have high life expectancy, as in the Asian Americans, or relatively low life expectancy, like the African Americans. And the African American populations that's primarily due to socioeconomics rather than some sort of genetic issue. So I think I'm going to skip over this. I think I'm going to skip over this. Actually, maybe I shouldn't. This discussion is two positions to be considered. Public health interventions are primarily responsible for the improvements in infant mortality, and then medical care interventions are primarily responsible for these improvements in infant mortality. It's probably both. Probably more so public health interventions. Making sure that people have clean water is actually probably the most important public health issue or impact for both life expectancy and infant mortality. Economic dimensions, very, very important. $3 trillion a year we're spending, 17% of our gross domestic product. That's how much we're spending on healthcare right now. We do have an aging population. That's part of the demographic trend right now. The baby boomers are all retiring. So there's going to be an increase in the diseases that affect the aging population. Makes sense because there's more of them. So there's going to be more dementia, more certain types of cancer are going to be more prevalent. Again, 2012, $2.79 trillion actually. 2014, it was like 2.9 something trillion. I'm sure 2015 probably passed the $3 trillion mark. Again, we're spending 17% of our gross domestic expenditures on healthcare at this point. This is the main reason why corporations are leaving the United States and going to other countries, because they can't afford the healthcare for Americans anymore. This is how much we spend per capita on healthcare. So the United States spends far more money per person on healthcare, and despite the fact that about 16 to 17% of the population does not have insurance, we still spend more on healthcare per person than anybody else in the world, far more, almost double than the average, or actually more than double the average, and we're not really getting benefit. We're still, our life expectancy is, a lot lower than all these other countries that spend far worse or spend far less. So it's not necessarily that the medical system is bad. It's just that we have a nation of very sick people, unfortunately. A lot of preventative medicine, public health could do a lot here. Unfortunately, we only spend 3% of our total health expenditures on public health. The majority of it goes to physician and clinical services and hospital care. More than 50% of that $3 trillion goes to the physician and clinical services and hospital care. It's very expensive to keep a hospital running. Prescription drugs, actually, it's only about 10%, 9 or 10%. That did double in the past 15 years, but it's still, relatively a small part of the issue. But again, you're going to see public health, a couple different questions asked about how much we spend on public health, and it's like there's a couple different parts in the book that talk about it. It's either 1% or 2% or 3%, certainly under 5%. And if you look at this, I think this is interesting. I don't think there's a question about this, but if you look at the Medicare, Medicaid, federal, Medicaid, state and local, and then the VA and the CHIP and government public health, it's almost 40% of the population is now covered by government. So these government programs. So we'll see what happens with the next election, if this will expand or not expand, or will shrink the government sector of that anyway. As far as public health public health activity expenditures, the main point here is that state and local expenditures on public health activity are much greater than they are for the federal public health activities. And again, the idea here is that most of the activity is happening at the state and county level, as opposed to the federal level. So these are just some public health spending. I don't recall that there's a question on that. Again, this is just the projection for what the population is going to look like as far as the age of the population. It's kind of hard to predict this. We don't know for sure, but this is, at least what they're predicting right now. So getting into geriatric medicine is a great idea, and getting into public health geriatrics is a great idea. So I would encourage you to work on your final project on that. I'm going to skip over these, and that was it for Chapter 3. I think I pretty much covered everything for Chapter 3. Chapter 4, let's take a look at this real quick. This is more about the law and the government and public health. Again, I'm not going to go through all this. You can read. This is just to help you with the test. This is one of the main issues, and a main theme here is that the federal government kind of shifts responsibility for public health over to the state level and the local level. So for the most part, the national government doesn't do a whole lot of public health. They kind of expect the state and the local governments to take that over. And this was extremely apparent during Hurricane Katrina a few years ago, well, more than a few years ago. But there was a huge delay in the response to that catastrophe, and the national government was saying, well, no, it's the state government's responsibility, it's the local government's responsibility, and the state and the mayor, who at the time, I can't remember his name, he's actually in prison now. The mayor at the time, went on radio and made this huge thing about how the national government, the federal government, wasn't doing anything, and it's because the federal government doesn't want to really do this kind of thing for public health. So our social values shift over time, and social values are really what kind of helps to drive a lot of these public health laws. There's another slide here. I'm going to talk a little bit more about social values here in a minute, because kind of skip over this. again, going back to the federal, state, and local health expenditures. So it is true that the federal health expenditures, so this isn't necessarily public health activity, but rather health expenditures. You can see the federal level is still much higher, but the state and local still spends quite a bit, and they are increasing more and more every year. The NIH, National Institute of Health, by far the biggest budget for public health services. This is kind of interesting. The majority of drug discovery actually does not occur in the pharmaceutical industries. The majority of the drug discovery actually occurs at the NIH and university research facilities. And then the researchers at the NIH essentially sell the rights to the drug to the pharmaceutical companies, who then continue to develop it. But the drug discovery actually happens at the NIH. And you can see that their budget, dwarfs almost everybody else. I'm going to skip over that. I think I'm going to skip over this. This was a test question, and I forget exactly what the test question was, but it was something along the lines of what percentage of state health agencies completed state health assessments or completed state health improvement plans. I forget which one it was, but it was one of those questions, or it was one of those anyway. So there you go. There's a gift for you for one of these questions. And then local health departments, again, where the rubber meets the road. Most of the public health activity happens at the county level, the state or the county level. And they get their money, of course, from state or federal agencies, but where the activity actually happens is at the county level. So at the local health departments, of course. And you can just see, I don't think there's a question about this one here. There may be a question about this one, some of the characteristics of the local health departments. I don't have the test open in front of me. I did review it prior to this, but I don't have them all memorized. Public health activity is a percentage of total health spending. So again, there's a couple different ways that they ask these questions about how much the public health activity spending is, and just make sure that you're reading the right question and you're looking at the right numbers, because public health activity is a little bit different than some of the other questions that they're asking, and it's not very much. It's under 2%. It's not a whole lot as total when we're looking at the total picture of public health spending, or federal health spending. I think I'm going to skip over some of this. Here we go. So science and social values, forces shaping government public health. So social values, extremely important in kind of driving public health laws. A perfect example, prohibition. In the 1920s, the prohibition of alcohol. Up until now, the prohibition of marijuana. And Pennsylvania just became, I don't know how many states, but they just legalized or decriminalized. I think they legalized medical marijuana, and of course it'll take some time for that to actually go into place. But that's a perfect example of societal values shifting, and whether this is a good thing or a bad thing for public health, I think remains to be seen. There's going to be it'll probably take a decade at least until we know for sure what this experiment is going to turn out to be, if it's going to increase health issues or if it's going to decrease or alleviate the burden of some things. I think there's a good debate could be made for either way. So social values, societal values, very, very important. Look at the vaccination, the way the vaccination is, the trends are now, a lot of people are starting to, push away from that. And it's having an impact. So, those social values do not always match up with what the science says. So, some of these social values are extremely important in driving public health. And this might be it. Yeah, that was it. So, hopefully this was helpful. Again, I tried to answer as many of the questions for the test as I could. So take your time, read through the textbook, and you should be fine. Okay, take care.